what we're seeing is sort of a group of three types of patients. They may have all three ingredients, so to speak, or symptoms. They may only have one of them, but usually it's related to respiratory, so shortness of breath, and that will actually, what you'll notice is an accompanied rise in your heart rate, which Dr. Oshana has, and then a drop in your oxygen saturation. Sometimes that can happen at sea level, like it is here in Sacramento. I've had a few patients, they make it as far as Auburn or a little bit past that, so about 2,000 feet, and they're already at a low level. I suspect Dr. Oshana would actually, as she drives up to Truckee, can measure where she starts to drop off as she's resting, and is actually at dangerously low levels by the time she hits about 6,000 or 7,000 feet. That's one subgroup. The other subgroup is one where, and you've noticed this in the literature a bit, and it's been reported in the lay press, where they have neurologic findings. So what we call strokes or brain fog or forgetfulness. That's another group. And then the third group is just extreme fatigue and exhaustion. So they may not have findings of respiratory or neurologic dysfunction, but extreme fatigue. We think the pathophysiology behind all of it is the same, but there's still a lot that we're learning. So that's the tough part with patients who have persistent symptoms. And, it's not just everybody who gets extremely ill. We have patients who have minimal symptoms at first, and then 2 to 3 months later, they start to progress with shortness of breath and chest pain. We have some patients who are profoundly ill in the ICU with us. They recover, they have no persistent symptoms. So there's not really a rhyme or reason, and the initial severity of illness doesn't correlate with that persistence.